Hello students, my name is Moon and this is He200, the EMT class at Queensborough Community College, and this is chapter 37 on terrorism. Actually, I'm not sure if it's chapter 37 or something because I'm using the slides from the 14th edition textbook and you guys are on the 13th edition. Either way, we're doing chapter 37 and 38 today, so review the chapter 39 video. So review the chapter 39 video and lecture slides that I should have posted by now, and then this video is for chapter 37, which I will be posting as soon as I'm done with this one here. So that's what we're covering today. Anyway, here we are. The information is the same between 13th and 14th edition. They just move the chapters around, they move the paragraphs around, but EMS is still the same. Okay. So this lecture is on terrorism, and I want to make something absolutely clear. Terrorism is a method. It is not a group of people. It's not a religion. It is not a nationality. It is not a color of the skin. It is not an ethnicity. It is not a political organization. It is a method, and a method can be and has been used by all of the above. Name any group of people out there and they've used it, or somebody who identifies with that group has used it. Now, when on interview, the representative of that group of people, whatever that group of, I'm just shrinking this slide, making sure it's fitting inside the YouTube screen. The representative from that group of people is saying, no, we are peaceful, reasonable people. We abhor violence. We reject extremism, and that is true. He is not. He is actually telling the truth for the vast majority of those people. However, for any group of people out there, you name it, even the ones who are famous for being pacifist, any group of people out there, there are a few individuals who publicly identify with that group who then went on and did an act of terrorism. So terrorism is a method. It is a use of violence or force to intimidate, I left out the I, to intimidate the rest, wrong control character, to intimidate the people of an area or their representatives, which is the government, to change behavior or policy. So how do they do that? Well, they tried reason, or they claimed that they tried reason, they tried negotiation, they tried the politics and voting, and then they didn't get what they want, or they feel like they're being ignored by the world, by the general world. So how do they get, in their twisted, crazy logic, how do they get the change that they're looking for? Well, they terrorize the local area or the people of the world to at least listen to them. How do they get attention from the people of the world when everything else is competing for attention on the news and nowadays on the internets? Will create an act of terror, and that surely will draw attention to their cause. Now, it seems to only draw negative attention, and it seems to only harm more than it helps, but in their crazy, twisted logic, they think that they are actually getting something done. Because in their view, they're thinking, well, at least we're on the news, so now people are paying attention to us, and after we finally get people to pay attention to us, then the negotiation can start. Then the compromises can start. But anyway, that's crazy, twisted logic. Nothing turns the world opinion against you better than harming innocent civilians. But this is the world we live in today. And like I said, it's a method, it's not a group. In fact, there are many people who are not affiliated with any specific group, but they just individually, on their own, decide to go and commit a terrorist act for their own crazy, twisted logic. and there are like lone wolves. If you've ever heard the phrase lone wolves, is a special kind of domestically grown terrorism where without direction, without definitely without approval, but without even identifying with any other group, individual decides to make the world a better place in his mind, and then goes and hurts a lot of innocent people. So these are the agents used in terrorism. CBRN. There's another mnemonic that also takes these letters, but and then rearranges them. But I'm not. It's a little. That's an ironic mnemonic. Instead, I like this one better. It's just a way to remember that each one of these methods, each one of these are an option or a method or a choice for the method of terrorism. And altogether, these are weapons of mass destruction, but you've heard that term a lot anyway. So anyway, you are in BLS, you are working on an ambulance, and then across the radio comes a lot of panicked voices. They blew it up, they blew it up. This the most famous event of terrorism in our country. Got the world on our side for a short while. But anyway, one of these days you might, I'm saying you could, but you might end up responding to a terrorist event. Hopefully you will never be in the middle of one, because then you are contaminated. But it's the world we're going into, and this is fair notice. Some people in EMS, when faced with a call like this, may decide, this is not what I signed up for. I'm only doing this as a job to provide for my loved ones, and I can't be part of this. Well, I'm not going to judge you, but I'm telling you that you knew this was going to happen one of these days. Sometimes first responders, even EMS, are deliberately targeted by these terrorists. And what they would do is multiple devices or a secondary. So what happens is they use a device to cause the terror and generate a lot of news, a lot of activity, and then EMS responds, and for them they have a second device that are set off, maybe maybe by remote control or maybe with a timing device, and it's designed to catch the first responders. And because what happens with that, the second device, especially when first responders are injured, that'll cause all other responders to stay away. So that's making the entire scene worse. I wish we lived in a different kind of world, but if these individuals, these perpetrators, want to cause the most panic, the most fear, this is one way that they can actually do it. By the way, it's a crime scene, but that's kind of obvious, right? Okay, AUTO is relatively new, and it stands for a checklist of things to keep in mind of that might clue you in that there might be a terrorist event. And the fact that you are a first responder, it's pretty much by default means that there will always be the possibility of a secondary. And again, that's just the world we live in. So what kind of places and people do terrorists look for? Well, remember, they're trying to cause the most terror. They're trying to get on the news, and the best way to get on the news is to cause the most terror. Okay, so they go for symbols and historic targets, political targets, etc. When I was actively on the ambulance, my mother a couple of times told me, when you're going, and I was especially in the subway system a lot, and they said, be careful, when you're getting down there, you be careful of terrorists, etc. And I told her, like, I'm taking you a subway in Queens. Nobody is going to target Queens. if a terrorist wants to target a subway, they'll do it in Manhattan. But nowadays, looking back, I'm thinking, you know what? Maybe they would, because especially if like the FBI and the CIA and the NSA gets wind of it and they send out an alert, then I'd imagine that police officers in Manhattan would be especially on the lookout. So it makes Manhattan a harder target. And if there's like a multi-step process of setting up the terrorist attack, then maybe the terrorist will go somewhere else, which is a little softer, like a subway in Queens or Brooklyn. So maybe I was equally vulnerable at the time. Anyway, nowadays I think we all are aware that it can happen anywhere. So the CBRN is delivered by all kinds of different devices. Should not, and the choice of attack location, but it's also the terrorist chooses a day, especially days of significance. But then same thinking though, during these especially meaningful days of our calendar, then the law enforcement and counterterrorism activities would be like especially peaked, right? Especially on alert. So maybe to increase their chance of success, they may choose a day that's not meaningful on the calendar. So once again, it means that we cannot ever let our guard down. We should always be on the lookout for warning signs. So anything that makes the hair on the back of your head stand up, anything that gives you a sense of foreboding, a sense of concern, makes you feel unsafe, then you really want to listen. You keep your ears open, your eyes open, and anything seems strange, then be aware. So TraceMP is a mnemonic that is intended to help you remember that acts of terrorism, weapons of mass destruction could be heat, thermal, radiologic, and this time it's the nuclear radiation. It's not the radiation from the OPQRST, it's nuclear. Asphyxiation is cause people to breathe in something that makes it difficult to breathe. Chemical damage, disease is etiology. I think they use the word etiology mainly to make it fit into the TraceMP mnemonic. Otherwise, they should have used D. Anyway, mechanical, so these are like bombs, shrapnel from the bombs, and of course, firearms. And then psychological. After all, that's actually the ultimate goal, to cause psychological terror in a population. So the best way to protect yourself from most of these CBRNs is the time, distance, and shielding. So the less time you spend in the area of effect, the lower the risk that you will be harmed, the further away you are, and then of course if anything, you can get something between you and the area of effect, that also reduces. This thing about distance though, well, I'll talk about it in class. Okay. So remember the lecture about hazmat, MCI, and incident command, right? If you are responding to a terrorist attack, you would be vectored to the cold zone, and then a hazmat team will be there to decontaminate the patient, and then you take care of the patient after they are completely clean. Then you have to watch for airway, breathing, circulation, mental status, of course. If you are already on scene and you didn't realize it's a hazmat until too late for you to retreat to a safe location, now you are contaminated. So don't climb back into your ambulance and drive to the hospital, because you are now contaminated. You may very well contaminate the emergency room when you get there. You want to stay on scene, protect yourself. You are now a patient. Protect yourself, and wait for hazmat to come and decontaminate you. The chemical can cause heat damage to you by reaction, can get into your lungs, and can have other effects on your body as expected. If the chemical is corrosive, then it causes mechanical harm, and the fact that you've been under attack can cause psychological harm. The hazmat team will be in different levels of PPE. Our PPE is right here on the extreme right. The N95, your regular uniform, good boots, sturdy gloves. That is not supplied by your ambulance company. So the veteran EMT knows to bring a pair of gloves from Home Depot or something. And then the helmet is 800. You're supposed to have a helmet on your ambulance. So what do you do with a chemical agent on scene, like you're already there? Well, then you flush with water, like we talked about in the toxic treatments lecture. I think it was the poisoning lecture, which was chapter 21. Okay, so anyway, biologicals. So there, you again, hazmat, because although it's a disease like virus, bacteria, or parasite, it has to be delivered somehow, and so that's where the hazmat comes in. Otherwise, we're a little better prepared for biological agents because our PPE is designed for biological agents. The toxins, maybe not so much, because sometimes it counts as a biological, that they would accumulate a toxin, like the terrorist will go to make a lab and accumulate the toxin products of biological activity, and then concentrate it and then disseminate it. It would be nice to know this information, but on scene at a terrorist event, it's going to be impossible. Just know that the larger the dose, the bigger the effect, and then the more dense the concentration, what results in the larger the dose, right? So the main routes of transmission or entry of a biological agent, how does it get into the body? It's through the skin, inhaled, ingestion, into the stomach, mouth and esophagus and stomach, versus trachea and lungs, and then injection. Okay, so contamination is you've been exposed, and for you to wander off means you might contaminate other people. You need to be deconned. You need to be scrubbed down by a hazmat team. Exposure is the material is already in the air or in the water or on your skin, versus contamination is actually on your skin. Patients must be declothed, remove their clothing. I'm not sure what to do about the personal effects. I never thought about it until now. I think it's gone. If it's a terrorist attack, those personal effects are destroyed along with the clothing. You don't want to keep your wallet and then the wallet be full of the CBRN. What's CBRN? The letters that stand for the different kinds of terrorist agents. So the biologicals can cause these different kinds of harms. Etiology is the way that people get sick from a medical problem. So it does make me question its use as a word here. I guess it's just the letter so that it fits the mnemonic, the ch37 mnemonic. For biologicals, absolutely wear your complete PPE, not only gloves, but gown, goggles, face shield. Know as much about what you're dealing with as possible. Buddy system. Do not wander off. Do not be a hero. Stay with your partner. You have to protect each other, because if anything, I mean, nowhere else has the BSI scene safety been more important than here. These biological agents and the terrorist event is designed to hurt people. It's not accidental life just doing what it needs to do, and you happen to be in the way. That's regular, normal infection. This one, it was designed in a secret government lab to cause harm. So you need to watch out for each other. And then after that, it's other members of service, and then the regular civilian population after that. Okay, nuclear radiation. So there are the two main ways we hear about in movies: the explosion, like a full-on nuclear detonation, and then there is the dirty bomb. So this is not a nuclear detonation. What happens is they take radioactive material, maybe ground in a fine powder, and then scatter it to the winds. So unlike a nuclear detonation that actually destroys buildings at ground zero, the dirty bomb disperses radioactive material, so that when later people show up with a radiation detector, it sets off. So they realize that nuclear contamination has happened into the environment, and that causes panic and terror. The dirty bomb, this RDD, is more practical, because actually getting a functioning nuclear device, explosive device, into this country that without being detected, without getting caught at it, is much harder. Also, obtaining a nuclear device that actually still works is very, very difficult, and now you need physicists and experts, world-class experts, all working together to deliver the thing. But if you just want to cause a lot of fear, then the dirty bomb, you don't need any special equipment. You just need like a lead-lined case, so it reduces the chance that it's detected. But then smuggled in, the usual way that drugs are smuggled in, maybe a submarine or something, and then just disperse it, just like a regular hand grenade in the middle, and disperse it into a cloud. And then as hazmat teams arrive and their radiation detectors start going off, they realize, oh my God, there's been a dirty bomb. And then the news finally hits the news waves, the reporters, the news channels, and then that sets off the panic, which is what the terrorist wanted in the first place. Nuclear radiation initially causes heat, especially the nuclear explosion, and then the radiation causes cancers, but that's going to show up like later. There are some chemical harms too, like chemicals packed with radioactive material, but also the heat and the radiation can cause chemical disturbances in the body too. The explosion causes the mechanical harm, and then the knowledge that you might get cancer will cause people to panic. This shows up on state exams. Like maybe you may get a question along these lines. So the four different kinds of waves: alpha, beta, gamma, and neutron waves. Neutron waves and alpha waves, not really a problem, because even like newspapers will block alpha waves, and neutron waves go through everything. Neutron waves go right through the planet. So there are neutron waves going right through us now, and that's just life. It's just living gets us get neutron waves. But the two levels, the two kinds we do care about are beta and gamma. Beta can be blocked by clothing, so this is like sunlight. Well, alpha and beta are like sunlight, sunburn kind of intensities. It's really the gamma now. Only a lead wall will block gamma waves, and that is where the X-rays come from, and that's why your dentist and your radiologist hides behind the office wall because that has lead in it, and that's why at the dentist they put a lead-lined heavy blanket over you when they X-ray your teeth, so you don't get X-rays into your reproductive organs. That's gamma waves. But time, distance, and shielding is definitely a question on your exams. Oh, so what kind of shielding? Well, here, that's what this graphics is for. It's a different kind, the shielding. And if you are worried about a radiologic, nuclear contamination, dirty bomb, you want to get as far away as possible. You want to spend as little time in the area as possible, and then get behind something solid and thick. Okay. So explosions, explosive events, can happen at any time, anywhere, and so the effects of the explosions are self-explanatory, right? There's two ways to respond. There's pre-blast. How do you know there's going to be an explosion? Well, training and education. And then after a blast, you be aware that there may be a second blast. You want to make sure you only go to the cold zone, the staging area, and have patients delivered to you. Weaponization is when you take a naturally occurring thing, and yes, even nuclear radiation is naturally occurring. Humans just found a way to weaponize it, to make a nuclear weapon. And then after weaponization, the nuclear energy was finally controlled and turned into nuclear power plants. But originally it was a naturally occurring event, nuclear radiation. So weaponization is taking a naturally occurring event and then concentrating it to cause as much damage as possible. The most effective way to get to cause a non-nuclear damage is respiratory. So either as a gas or in fine particles. Either way, make people breathe it in. And then, of course, there's the virus. And respiratory viruses are the fastest to spread across a population. That's why there was a lockdown. The COVID virus was respiratory, and that's why it caused the lockdown, the social distancing, and the mask, because it spread so fast. We don't get a lockdown from a sexually transmitted disease. We didn't get a lockdown for AIDS. We didn't get a lockdown for Ebola, but we got a lockdown for COVID. So respiratory is the easiest way to spread in a population. There are other ways. Did you guys hear about the methanol poisoning in that Asian country? Somebody sold bad alcohol and methanol instead of ethanol got in there, and a bunch of tourists, including at least one American, got killed. So that's ingestion. Now that story was accidental. I'm sure, well, I'm not sure, but the chances are that it was bad alcohol. Somebody bought alcohol on the extra cheap, and it was extra cheap because whoever made it didn't make it properly, and then it caused this tragedy. But there is a way for terrorists to cause ingestion terror, like poisoning the municipal water supply, poisoning the food in a restaurant, all the ways. Dermal is absorbed right through the skin, and then human to human contact, that's like the hardest one to cause terror with, because all you have to do is identify the people who are there and round them up and isolate them, and then everybody else is just going to go back to watching their music and cat videos once you're told everybody's been found and isolated. So it's the hardest way to cause terror. So inhalation is the route of choice for most terrorists. If you put an energy behind it, it'll make the cloud spread wider. Makes sense, right? An explosion, a fan, that's all energy. Okay, CBurn, remember, chemical, biological, radiologic, nuclear. What's the difference, radiologic, nuclear? I'll leave it as an exercise to do together in class. Where were we? We're near the end. It's we definitely didn't see that. Okay, so so we talked about the chemical already, and that's like a desiccant, or corrosive agent. So chemical burns, either acid or base. Base can cause a chemical burn, can also cause respiratory problems, like World War I weaponized gas. That's a chemical agent. So skin or breathing, really. Insecticide, organophosphate poisoning, plant insecticide is one common example of a organophosphate, and it is the parasympathetic overload. Remember what parasympathetic stood for? The sympathetic versus parasympathetic. This is parasympathetic. Parasympathetic is rest and digest. That's the nervous system. Sympathetic is fight or flight. So if you overload the fight or flight, you literally cause a heart attack, because fight or flight is when the heart rate goes up and the blood pressure goes up. So if you overload the sympathetic nervous system, then you cause a heart attack. But if you overload the rest and digest, parasympathetic, you cause sledging. These are all the things that these are all the organ systems affected by the parasympathetic nervous system. Saliva, lacrimation is tearing, peeing, pooping, the GI system, vomiting, and meiosis is when the eyes, pupils expand, dilate. So dilated pupils instead of constricted pupils. So these are all triggered by the parasympathetic nervous system going too hard, overloading the parasympathetic nervous system. A vesicant is causes the epidermis to separate away from the dermis, and that causes a pocket where that fills with fluid, and that's a vesicle here. If a chemical agent gets in the lungs, like a World War I weaponized gas, then it can cause respiratory problems. Like one of them caused your lung fluids to turn into cement. I remember like a story like that. Cyanides prevents the mitochondria from converting oxygen and sugar into ATP. Nerve agents prevent your nervous system from acting properly. One of them is the parasympathetic nervous system, which would result in sledging. Some agents wasn't intended to be permanent, like when there is a riot, a crowd refuses to disperse, and then finally the riot police fire tear gas. That's a chemical agent. And some of you may be carrying tear gas in your pocket when you go out there to defend yourself. So these are irritating, and it causes severe tears people causing tears and coughing, and it's so irritating that it's hopefully will make the attacker stop. So now, what if terrorists got like a gallon of this stuff and just dumped it into a public, like in a park or at a parade or something like that? That'll cause a lot of panic. Anyway, the problem with bacteria and viruses is that it takes a while for the effects to be felt. So it causes like a lower level panic, and it's mostly noticed by the healthcare system, and it doesn't really interest the public until the news breaks, until the news organizations find out about it, get a leak, and then they start talking about it, and then people can start panicking. But it's like a delayed reaction. So bacteria virus spread may not be the choice for a terrorist, but they can go for toxins, however. So toxins are the concentrated products of biological activity, and that can have an like immediate effect, like minutes or a couple of hours. But if they do want to spread a virus or a bacteria, then they worry about these things. So here I define these for you. This is my understanding of these terms. If the textbook says it slightly differently, then believe the textbook. But I think I got it right. I'm going through this a little quickly to respect your time. That doesn't mean that you didn't have to know it. So, like I said, time and time again, you need to read the textbook if you want to be a good EMT. So here are some examples of bacteria that have caused panic in the past, and you're not expected to be a doctor, you're not expected to know these for your exams, but just like a historic references. Here are the toxins. So ricin was, I guess, for you guys, ancient history, but I remember when this news hit, these reports hit the news. Ricin was a toxin used in a subway in Japan, and so it's possible for it to happen here. It's just you just need somebody who knows what they're doing with biology to make this happen. Botulism, the Botox, the toxin used in Botox treatments. Those are given in very, very tiny amounts and hopefully given in a very controlled way. But if it's accumulated and then spread, then it can cause and so the main problem with botulism is it causes the nerves to stop working. And the person, not only does it cause the body paralysis, but which organ, mainly which muscle do you really need, and which finally gets affected and will threaten your life? It's the diaphragm. So botulism's first life threat is that the patient stops breathing because the diaphragm, the muscle, stops working. But eventually it'll work its way to the heart, and then the heart will stop beating. Staph bacteria infections. This one, it causes bacterial, like signs of bacterial infection would happen within like minutes to a couple of hours. I don't really know this one. Oh, mycotoxin. Myco is fungus, mushroom. So people eat mushroom toxins. People eat psychedelic mushrooms recreationally, but what if it was concentrated, weaponized, and instead of the mushroom that causes psychedelic effects, what if they used a mushroom that causes other, like poisonous effects? All right, so it's just one of the biologicals. All right, viruses again takes time to spread across a population. So by the time the public is made aware through the news, then It's like a delayed, subdued effect of terror, but they might want to do it that way. They, as in the terrorists. Um, Viral hemorrhagic fever. So, Ebola is one of the viral hemorrhagic fevers, and people bleed from their every hole in their body. So, hemorrhagic, right? So people bleed from their ears, from their eyeballs, as well as their nose, mouth, and every other hole they have. Scary thing, scary thing to have. But this happens like this spreads across a population in real life naturally. So maybe not something a terrorist would use to like focus attention to themselves. So the dirty bomb I already talked about, and it causes cancers. Incendiary device causes fires, blast injuries. So remember all the way back in the first week of class, all the way back. I don't remember if I did it or if Dan did it, but we gave you chapter 6 anatomy, and we got to the abdominal organs, and we warned you, you got to know which ones are hollow, which ones are solid. Here it is. You need to know the organs that are hollow because they are the ones that are vulnerable to blast injury. Solid organs are especially vulnerable to laceration, so penetrating injuries. Which means that if you respond to a explosion, then be prepared that your patient may be injured in these ways, and they will have the symptoms representing these things. Okay. So yeah, you are expected to treat your patient for burns. You know how to treat for burns, right? How to treat for blast injury. Well, the short of it is airway, breathing, circulation, and then mental status checks, and then the notification ahead that to the ER that the patient is a blast injury patient. Okay, one more time. Download the ERG onto your phone and play with it. We will definitely do some practice runs through the book when we are together in class. Somebody, the incident commander, the incident commander will be in charge of making sure everybody affected was isolated so they don't spread it to other people in case there's a contaminant aspect to it. Perimeter needs to be placed and controlled. That's police, mostly incident command and police. Notification, you want to tell all parties who need to know, right, the information they need so they can do their job properly well. When you get a patient with a hazmat exposure, then know your way through the ERG. You should be properly protected and only protected up to the level that is expected of you. So you don't have to scrounge up a higher level hazmat suit, because you should never get a patient who is not yet decontaminated. But BSI scene safety, always. Keep your eyes and ears open, keep your head on a swivel, so that if something looks suspicious or gives you a funny feeling, listen to it. Listen to your sixth sense. Listen to your body, so that you can. It may very well save your life. A little paranoia is a good call in these situations. And hazmat decon, right? Okay. So you take all of this information that you've heard so far and apply it to yourself. Be aware, be on the lookout. Are you starting to feel a rash or discomfort on your skin? Are you starting to feel difficulty breathing? You need to get deconned. You need to be treated. If the patients you have are complaining about these things, and then remember sludgeum now. So it's good for you to memorize sludgeum. The test Example, the test question is not going to say which one of the following are sludging. That's too easy. Instead, they're going to say your patient is tearing excessively, vomiting, they have, and they're complaining of stomach upset. What should you do? And the fact that they're tearing and vomiting, and then the stomach is a clincher, then then they're drooling like crazy. What should you do? And now you worry about sludging. It doesn't necessarily have to be a terrorist attack. What if the question says you're dispatched to Home Depot, the gardening section, and there was an accident. That's all they said. There was an accident in the gardening center section of Home Depot, or Walmart, whatever. And so you go there and you find the patient is a staff person, one of the staff, and he's laying in a puddle of yellow or green liquid. Let's say green liquid. So now you realize it's a hazmat situation. And why did I say Home Depot? Because of pesticides used in gardening. So the pesticides, a popular version of pesticide is an organophosphate, and it causes parasympathetic overload. So what do you do for this patient? You give him airway, breathing, circulation, okay, and transport, of course. So stay on the lookout for signs of a mass casualty incident, and possible dead animals and vegetation. Warning sign, right? If by the time you smell something funny, it's probably too late for you. You are now infected or contaminated, but you want to be at time, distance, and shielding, right? You want to get distance, and you want to minimize the time you're on scene. Be understanding now that you may now be contaminated or infected. So don't immediately go to the ER. Don't immediately say, I quit and go home, because you may infect or contaminate your loved ones. Here's the auto again. Don't be a hero. Don't be a Rambo. Use the incident command system. Go to the cold zone staging area. Follow orders. Remember ch37. If you see this, you're too close. You've seen this in movies, right? This is the bomb squad. If you see somebody wearing this, you are too close. You want to second guess your staging area. Did you wander far from your staging area? So, the only time you should see this is if he is already walking. He's walking from his vehicle to the hot zone. So he just went to the cold zone to dress up. Okay, so various resources. We live in a time of active shooter. Don't be a hero. Stay back. Cyber terrorism. So computers are involved. Why does that affect you? Because cyber terrorism sometimes targets infrastructure like hospital systems, the water treatment, warehouses that contain dangerous chemicals. So that is something you should always keep in your mind. And who knows, maybe terrorists will invent something new that's not on this slideshow, and it'll have to be added. Anyway, you've heard enough from me from both lectures now to be better prepared for these questions on the final exam and the state written exam. I wish you good luck on that, and I will see you Monday.